Good morning, Mr. John. I want to talk to you about the new medication we're prescribing you called Finasteride. It's used alone or in combination with another medication to treat your BPH or your benign prostatic hypertrophy or your enlarged prostate. Finasteride is used to treat the symptoms of the BPH, such as frequency and difficult urination. It may reduce the chance of acute urinary retention or the sudden inability to urinate. It may also decrease the chance of prostate surgery will be needed. Finasteride can also be used to treat male pattern baldness, but in your case, we're going to use it to treat the BPH. Finasteride treats BPH by blocking the body's production of a male hormone that causes a prostate gland to enlarge. So finasteride is a compound that works by suppressing that production of that hormone. It's called DTH. The maximum effect of a rapid reduction in DTH concentration in your blood is expected to be observed within 8 hours following the administration of your first dose. This is good. In a single man receiving a single dose of 5 milligrams of finasteride for up to 4 years, there was a reduction of the amount of DHT by approximately 70%, and an increase their level of testosterone, another hormone, by 10 to 20%. It's going to be good. It's going to help you feel better. It is expected that the DHT levels will return to normal within about 14 days after stopping the medication. So it's important not to stop it without talking to your doctor. The effects of the finasteride are reported to be more pronounced in male patients with enlarged prostates who are the greatest risk of disease progression. Now, your finasteride is well absorbed following oral administration. You can take it with food or you can take it without a food. It doesn't matter. The finasteride undergoes it is metabolized through the liver. So that's where it will break down and go where it needs to go for you to start working. The route of elimination for this medication is through urine and through feces. Now there are some adverse events. So common adverse events with finasteride is erectile dysfunction, ejaculatory dysfunction, and loss of libido are the biggest adverse events that we've seen. These events tend to disappear after discontinuing or after chronic use of the drug. Now, there's some special considerations for different populations with this drug. Finasteride can be safely used in elderly patients or those with renal impairment with no specific dosing adjustments recommended. Finasteride is indicated for male patients only. It is not advised that exposure to finasteride, broken or crushed pills or capsules, is to be avoided by pregnant women carrying male fetus, as it may lead to abnormal development in the male fetus. Finasteride is also not indicated for the use in female patients. Again, you can take your food with or take your medication with or without food. Just try to take it at the same time every day. There are several drug-to-drug interactions, so make sure that we know all the medications that you're taking, and so does the pharmacist, so they're aware. Is there any other questions that you have for me?